So really, you're looking at a lot of people in our community right now.
Absolutely.
And so we are seeing VitaHealth grow as well as all of our other programs. Now, coordinated care, which is our flagship program, that began 15 years ago, and health coverage was something that the healthcare district took very seriously long before it hit the headlines. And coordinated care serves lower income residents. So we are a safety net organization, and I know you've heard that term probably a lot as you've been working on these various stories, because all of these programs serve residents who don't qualify for the federal and state programs that are offered.
So you will see some changes, obviously, because they could possibly qualify depending on what comes out. But people like Robert who age out, then they go into a federal program, so they're not left high and dry.
That's right, that's right. In Robert's case, he's now eligible for Medicare. So the goal is to have that safety net, if you will, for our residents so that they have health coverage to establish that medical home, which we believe is so important, and begin that preventive care process. I mean, with VitaHealth, the services for $30 a month for premiums, that is as low as $30 a month, you know, the services include prescription drugs, hospitalization, primary and specialty care, labs, mammograms.
So they're not lacking or only limited to a certain, you know, primary health benefits, say?
We have a network of providers throughout the county. Within the VitaHealth program, more than 200 doctors and healthcare providers. So not only do we offer the choice to the members, we also support the providers who practice in our community.
Well, thank you for joining us, and we hope that whatever comes out of Washington, it'll just, you know, benefit all the residents. Thank you.
Thank you.
Well, if you think you or somebody you know may qualify for the programs we just talked about at the Healthcare District, here's the number you need to call and check. Well, those that do have insurance or at least a safety net choice often have doctors they can go to. But what about those who don't qualify for programs or just don't know they exist? There's a place in the heart of downtown West Palm that offers hope to them. It's a small clinic that started with a big dream of a congregation, and despite economic setbacks, is still opening its doors every day.
As another sun rises over one of the wealthiest towns in the United States, it also begins another day for those who live just over a short bridge, but whose lives are a long, long way from the ease and elegance that describes Palm Beach. In the heart of West Palm Beach, you will find neighborhoods trying hard to survive in this economic downturn. Here is where some of the poorest in Palm Beach County call home. And here is where young and old wonder how they will afford the basics most of us never think about.
South Florida is so unique. We have the wealthiest of the wealthiest here. We have the poorest of the poor and everything in between. And I think if people were to know and to experience and make that connection, it would make a difference.
One of the biggest needs after food and shelter is health care. And that is what inspired a local Baptist church to open the doors on a free clinic in the heart of one of the toughest neighborhoods.
And so they got together and said, you know, we need to provide something. We need to do something, help those who are hurting, provide care for those who don't have it. And so over the years, it's grown into this now 6,000 square foot facility.
The clinic offers basic family practice care and was designed to be a safety net clinic. But that is changing.
Now we have people who have come to the clinic year after year after year, and we're serving as a primary care facility. We have diabetes, cholesterol, hypertension, heart disease, anything that a family practice or internal medicine doctor would see, we have everything.
It is all offered regardless of ability to pay.
We have guidelines that permit us to see people who don't have the means to pay for their own medical care.
The definition of everybody who needs medical care is rapidly changing. As the unemployment rate in Palm Beach County continues to rise, the clinic is seeing a new breed of patient.
Increased is probably an understatement. It has been unbelievable, double, tripled. I would say in January we had almost close to 300 plus new patients between January and March. And it's steadily increasing. We find as the economy continues to constrict, people who have had jobs, who've had medical coverage, now don't. People who have used to be maybe college degrees and find themselves in a situation that they never could imagine.
How are you doing today? All right, yourself? Good. What brings you in? I'm coming back.
We're serving people from at least 20 zip codes or more. We have people come from as far south as Boca Raton and Fort Lauderdale. Far north is Jupiter, and as far west is Belglade.
To give a better glimpse into the need here, on the day we arrived hours before the doors open, dozens had been waiting outside in the heat.
Today is Tuesday, and Tuesday and Thursday we have our evening clinics. And we have people lining up as early as 8 a.m. The doors don't open until 5 o'clock. But we have that in place so that people who work, who can't get here during regular clinic hours, daytime hours, can have an opportunity to receive care. And we've found that it's increased maybe from 40 people outside waiting to just a couple weeks ago, 60 plus. And it's continuing to increase. And we don't have the resources to meet those kind of needs.
Free care is possible, due in large part to volunteers who are the backbone of this busy clinic.
None of our doctors are paid. They're all volunteers.
The health center is not immune to its own struggles because it runs mainly on the generosity of grants and donors. Robert says they have felt the pinch.
One of the things that I think gets missed in this whole equation is that, yes, we want to see more people. Yes, the numbers are increasing, but there's a rate of consumption of our supplies and our resources. It's the things simply as Q-tips, gloves, things of that nature that may seem simple, but if we're increasing the number of patients, we're going to increase our rate of consumption. And if we don't have funding, then we can't replenish, and then we're going to eat up our resources much quicker.
They have had layoffs and had to cut back hours, but Robert is hopeful that things will get better soon. And he hangs on to the stories of those who have gotten healthier because of the medical care here and the gratitude they show.
We really about meeting the spiritual mind, body, and spiritual needs of people who come through our doors. So we will spend, if it's 15 minutes, 20 minutes to an hour, just talking to somebody if they need.
All of the information we provided this evening will be available on our website. That's wxel.org. In addition, make plans to join us right here Monday, November 16th, for a live version of Health Matters. We're going to have a panel of great experts that will probably have the answers you need to know when it comes to the healthcare debate, and some of the answers you may need to know to figure out your own healthcare crisis. Remember, that's Monday, November 16th, right here on WXEL, and WXEL FM will be following up our Health Matters show with its own version on Florida Forum. Thank you for joining us. Thank you to the Community Foundation for Palm Beach and Martin Counties for helping bring this show to you this evening. We'll see you again next time.